So when we work with a fibromyalgic patient, we have to first determine what it is that the cause of the fibromyalgia may be coming from. So for example, people that have fibromyalgia, they have diffuse pain throughout the entire course of their body. They don't know where it's coming from. They don't know why they have it. Many traditional medical procedures will try to treat the pain with some kind of suppressive medication so the patient doesn't feel the pain. With nutrition response testing, what we want to do is go a step back and say, well, why does the patient have pain? What is causing the pain? Many times the pain could be caused from an underlying toxicity that could be coming from something else going on in the body. Now, what could that thing be? Well, that could be something like an infection. It could be a parasitic issue. It could be an H. pylori issue, a bacterial problem in the gut. I've seen yeast overgrowth. I've seen chemical poisoning. I've seen heavy metals. So to just take a dart and throw it at the wall and see what sticks is not the best approach to this. There's actually a way that we can ask the body through examination, what is the problem that's weakening the body? And through examination, the body will show us. Then we can actually find the right nutrient that will strengthen the body by examination. And then we can begin the process of eliminating the toxicity and restoring the health to the patient over a period of time. That seems to work best for the patient and get the best results. And no two patients are ever alike, and no two solutions are ever alike, because everyone is an individual. And that's how fibromyalgia responds to nutrition response testing. So normally when we work with a patient with fibromyalgia, we would recommend a treatment course of roughly about 120 days. And the reason why we suggest 120 days is because that's the life of a red blood cell. So being that we're trying to treat the body from a cellular level, and we're trying to rebuild the body on a cellular level, we want to give the body a chance to begin to regenerate itself over the course of 120 days. So that roughly breaks down to about 4 months. So on average, a fibromyalgia patient who's beginning to work with us, we would ask them to invest 4 months of time to break down and restore and rebuild the body so that we can actually change them on a cellular level, which will actually last them going forward. So there are many practitioners throughout the country who will test and evaluate people for nutrition response testing. There are roughly between 400 and 500 now practitioners that have the level of clinical training that's recommended for this level of care. They can be found throughout the country, from east to west, north to south. What I would suggest is if one wants to find a practitioner and doesn't have the ability to contact me, you could just go to Ianniello Nutritional Systems, and they're based out of Clearwater, Florida, and that is the hub of where nutrition response testing education takes place. And then from there they can ask for a recommendation to a local practitioner local to that person's demographic area. A fundamental aspect to nutrition response testing is the fact that as we help the patient heal from the inside out on the cellular level, the beautiful thing of this is that as they go forward, they begin to heal themselves with food. So where the practitioner is filling in the nutritional voids that have not been met recently, as the nutritional components are put in, the body, like a puzzle, begins to put itself together. And then going forward, as the patient is well, we give them guidance with eating proper nutrients and proper food through their diet so they can maintain their health afterwards. And that's very valuable too, because they learn how to eat for health. And we find it to be very important in helping people maintain long-term results versus short-term results.